Hello, I'm Alessandro Di Rocco. I'm a professor of neurology at the Zucker School of Medicine at Hofstra University in Northwell Health, and the system director for Parkinson and movement disorders at Northwell Health in New York. I'm also a board member of the Parkinson Foundation, and I'm like to introduce my colleague, Dr. Ritesh Ramdhani.
Hi, thank you, Alex, for having me join this webinar. I'm Dr. Ritesh Ramdhani. I'm a movement disorders neurologist and assistant professor at the Zucker School of Medicine at Northwell. I also serve as the director for the Deep Brain Stimulation Program at Northwell Health.
And it is our privilege to discuss as part of the PD Health at Home series of the Parkinson Foundation, lesson learned from the frontline, Parkinson's disease and COVID, on how the epidemic of COVID is affecting the Parkinson community, and relate our experience in New York, which is the front line of the epidemic. I like to introduce the discussion. We have received a number of questions, and those questions will help us really frame a discussion on how this new entity, this virus, has really affected the Parkinson community. And the first question that we have received, and that is a good introduction to our discussion, is: are people with Parkinson's more susceptible to COVID-19 or more serious complications from it? And the answers that we have so far, judging from our own experience, our network is indeed the medical institution in the United States with the highest number of COVID patients. And we certainly also are aware of experiences of colleagues around the world, especially colleagues in Europe who have been experiencing the epidemics a few weeks before it started here in New York and in the United States. The answer so far, and the numbers are growing, but so far what we understand is that people with Parkinson's disease are not especially vulnerable to COVID-19. Obviously, the risk factors that we know, like age or men were more likely to be affected than women, are the same for people with Parkinson. So most people with Parkinson are above age 60. This is per se is a risk factor. Or there are more men than women who have Parkinson. But there is nothing specific about Parkinson's disease that will make it more vulnerable, that will predispose to the infection. However, as we will see later on, as we discuss some of the other questions, it is possible that when someone with Parkinson's disease becomes infected, that the disease will manifest in somewhat different ways. And we will address this in the coming questions. I would like Dr. Ramdhani to
Sure.
address the following question.
Okay. So the next question that was sent to us is, are there any preliminary numbers of people who had COVID and PD? And a follow-up to that question is, do you think we'll ever know this number? Well, we don't have that information as yet. We're starting to see small reports of a small number of Parkinson's patients who have been hospitalized with COVID, and we're learning about how they did and the complications that they've had. But it's too early right now to know exactly how many Parkinson's patients, both in the United States and globally, have been affected by COVID, and what their follow-up and complications have been. I think it's also important to know that Parkinson's patients who do contract this infection are at risk to see their underlying motor symptoms as well as non-motor symptoms become exacerbated. So we can see, and we've seen patients become more stiff and slow and develop worsening of their tremor. And in those circumstances, there needs to be quick and robust management of their underlying Parkinson's symptoms while they're trying to battle the COVID infection itself.
And I think this ties to our next question. It says, do people with PD, with Parkinson's disease, experience different COVID symptoms than the general population? And the answer is that probably there is a different way in which the initial symptoms may be different. We know from experience and that an infection in Parkinson may manifest with before the actual even symptoms of the infection, whether it's a urine infection or bronchitis of any kind. And certainly is the case with COVID. There may be some extra tiredness, there may be some confusion, there may be some worsening of the dyskinesias, there may be some worsening of the balance or tremor or other symptoms. So this is a way in which COVID, and at this day and age in New York City, in New York, and in many parts of the country, anytime there is a sign of an infection, our first thought is this COVID? Can this be the beginning of COVID? And this is something to keep in mind because right now is the most common infection of any kind that is spreading. So one first thought to keep in mind is that if there is any kind of sudden change, not part of the variability that every person with Parkinson will experience, but something really maybe changing, extreme tiredness or unusual symptoms or really something that doesn't seem right, even if there is no fever, even if there is no shortness of breath or coughing, this may be an early sign of COVID. And that's part of what we are learning. Once the disease once the infection as sometimes can become more serious, as we all know, some people have a very mild form of the disease, other people have a more severe form of the disease, and certain people have an extreme form of the disease, and of course, unfortunately, a number of people die. Now, people with Parkinson, as far as we know, are having the problems that they have whenever they are hospitalized, if the disease leads to be hospitalized. So as we all know, and as part of our actually efforts with the Parkinson Foundation, going to the hospital for someone with Parkinson is a challenge. And the effect of the hospitalization with COVID may highlight some of these problems. However, there is no indication that the pneumonia is any different than it is in someone who doesn't have Parkinson, or than any other complication of the infections are any different. It's just that Parkinson may pose an extra challenge. Dr. Ramdhani, do you have any other?
Yeah, no, I think that captures really the potential presentation that a Parkinson's patient can experience. It's the non-respiratory lack of fever and shortness of breath, but increases in other symptoms, as you nicely outlined, could be the first presenting symptoms for someone who's contracted COVID. While Parkinson's itself does not suppress or make us any individual patient immune compromised, or increase their risk of getting the infection compared to the general population. The fact that having that motoric symptoms poses a greater challenge in terms of the recovery. And so the longer a patient has Parkinson's and have more symptoms of Parkinson's, they may face a longer road ahead in terms of overcoming the infection, as well as sort of getting back to their baseline functionality prior to the infection. So the next question is, how have outcomes for patients with PD, with Parkinson's disease, who test positive for COVID compared to the general population's outcomes? Yeah, again, it's too early to say, but from the small data and from our experience at Northwell, what we're seeing is that it all relates to how other underlying comorbidities that a Parkinson's patient may have that raises their risk of severity of the infection, as well as what is becoming more evident is that the longer you've had Parkinson's disease, there may be a risk that you will have a prolonged recovery phase. Again, this is very early data, and we're going to see more and more of this investigated in the coming months ahead. But right now, I think that it's fair to say that the more susceptible you are from a functionality point of view, the more vulnerable you may be to the long-term effects, at least the near long-term effects of COVID.
I agree. I also want to make the point that we have seen a number of patients. And just yesterday, I was talking to a patient who is in his late 80s, who has fully recovered from a COVID infection. And so it's important to think that there are numbers and statistics, but the individual is really, the individual response is really what matters.
Yeah.
And most people, even those people who get to the hospital, will survive and will recover from this disease. Now, Parkinson is an extra challenge, but we have seen many people recovering and going back to their lives and doing really well, despite the infection with this COVID virus. One of the messages that we have for our patients in our community is that the sooner you recognize the symptoms, the sooner you get in touch with your doctors, the better chances you have to do well, even if you become infected. So when we were emphasizing the fact that, you may suddenly feel a little out of sort or a lot out of sort, actually, it's an infection that makes you very tired. And you may have, suddenly the dyskinesias are uncontrollable or any other symptoms that we discussed. This may be the very beginning of the COVID infection. And to control them and to inform your doctors and start the therapy, the intervention, which we may not have a specific virus intervention, but we may have ways to sustain the breathing and control all the other complications. And people do well. The sooner you intervene, the better it is. So there are many great stories, many people who have been in the hospital, but who have walked home and are well and continue to do well. So this is an important message to be kept at heart, that even if, and obviously we hope nobody becomes infected, But even if that should happen, that doesn't mean that there must be a bad outcome. Most people recover. Most people do well.
Yeah, I think I want to echo those sentiments as well. And we have no evidence that mortality is higher among Parkinson's patients who get COVID. Um, the I share the same experiences as Dr. Di Rocco. Our patients or patients that we've been involved with their care who have Parkinson's and developed COVID have done well. They've left the hospital and they're on the road to making a full recovery. So in no way does this put our Parkinson's patients at a greater risk in terms from a mortality standpoint. It's just another layer of challenge that we have to take into consideration as we treat you and we manage both the COVID as well as the Parkinson's symptoms in getting you back to your baseline quality of life.
And one additional point, remember whenever, if someone becomes infected and needs to go to the hospital, that those same sort of that same awareness of bringing the Parkinson medication and possibly the Aware and Care kit that the Parkinson Foundation has developed, which is an amazing instrument, is as important, if not even more important, during this crisis, because Parkinson medications help you breathe, help you actually fight the infection indirectly, because if you maintain a good breathing pattern and strength in all the muscles, including the respiratory muscles, then you have better chances of fighting the infection. So that continued good care of Parkinson, which should be extended in the hospital, is very important.
Yeah, I think that Aware and Care kit is a great tool to have, because if you do end up having to go to the emergency room or be hospitalized, most hospitals at this point, especially in New York, in hard-hit COVID areas, are not allowing visitors in the hospital or to stay with you. So it's really important to have a kit like that that can inform the treating team to the important medications that should be avoided in taking care of you while you're in the hospital, as well as other therapies that need to be considered in order to help you fight this infection should you get it.
That's a very important point, yes. And this may be the most difficult part, to be alone in a hospital. We are not allowing, no hospital is allowing any visitors, any family members. And this can be really the hardest part, to be alone in facing something as big as this. So to have that kit and your cell phone is very important.
Yeah.
And a charger for your cell phone. That's really important. The next question is changes a little bit the tone, and is do you see any long-term or permanent changes in office procedure or patient care because of COVID-19? And the answer is that yes, we are changing the way we practice medicine. And it's likely that some of those changes will last for a long period of time. In New York, most clinics are closed. We only see patients for very urgent matters. We do not allow family members because obviously we're trying to limit the spread of the contagion. And medical facilities, unfortunately, are high-risk places for people for exposure to the virus. We are suspending at this point some of the procedures, such as the brain stimulation. We had a number of patients who were waiting to have the procedure, and we had to delay this. And now, as the wave of the epidemic is easing up, at least in New York City, we are already working and planning and reopening some of our offices and activities. But the way we'll be doing this, at least for a number of months until this epidemic is completely controlled, will be different. Waiting rooms will be different. The way we will be, the procedures, the way even we'll interact will be different. And many people are already experiencing the challenges and to some degree the benefits of telemedicine. So we continue to remain close to our patients by switching the visits in person to telemedicine. Now, maybe because I'm a little older, I'm not exactly too fond of this. I like the human contact. I like to really see the people who do my work and my patients, and so I miss very much that aspect. Um, and but this is the safe way right now to do it, and part of those changes will remain for a number of months to come.
Yeah, and when it comes to telemedicine, it's I agree. It takes away that human contact, that experience we have with being in the room with our patients' family members and caregivers, to really understand and to see and to witness for ourselves what the toll the symptoms can have on someone. But on the flip side, I think that some of the advantages that we're starting to see with telemedicine is that it's giving us an insight into the living environment and the natural living environment of our patients for the first time. We're able to sort of see how they're moving and how they're spending their days in the context of their homes or apartments. And we're starting to think about how do we tailor our treatment? How do we tailor our recommendations based now on what we're seeing and understanding the confines at which they're living in at this time. So I think that while it has removed us physically from our patients, it has in a way brought us into their homes, and I think that it may lend itself to a very an added level of treatment that may not have been there prior to this pandemic.
Yeah.
I think the next question we've touched upon, but we could summarize. It asks, what has the Parkinson's patient experience been like in New York during the pandemic? Do you anticipate that experience becoming more common across the country? Well, I think we've addressed this in our discussion. I think the important things to take away is that the infection can present as a typical respiratory illness in Parkinson's patients, as well as it could present with just a pure worsening of underlying symptoms or symptoms that we may not typically associate with COVID, as Dr. Di Rocco had outlined before. Worsening fatigue, maybe a little bit of a delirium. These are certain things that need to be taken seriously and brought to healthcare providers' attention immediately if they were to occur. We've also discussed the fact that Parkinson's patients are not at greater risk for getting COVID, but their recovery based on how many years or how severe their Parkinson's is at any given time could affect the duration at which they recover from it. And let's keep in mind that the mortality is not higher among Parkinson's patients compared to the general population. We do not have any evidence of that at this time. And I think that the rest of the country that may be starting to see waves or mini waves of COVID can learn from our experience and the shared experiences that we and others are seeing with how we care for our patients and the sort of symptoms and complications they may be experiencing in the hospital, as well as when they leave the hospital and their recovery. So I think that while this is challenging times, this is um, an extremely contagious infection. We know more about it than we've ever done, than we ever did, and our ability to treat it and to treat the Parkinson's concomitantly has evolved, and I think that's putting our patients in a better position for full recovery.
And if I may add, one of the other consequences of the Parkinson community during the epidemic, and again, shared by the population at large, has been the isolation. Has been the effect of the lockdown, the effect of the being forced at staying at home, and for most people with loss of physical therapy, occupational therapy, speech therapy, support groups, and all the other elements of care that really are so important in people with Parkinson's lives. This has been a challenge, and there have been online and remote and tele-rehabilitation, telespeech therapy, support groups online, Zoom groups, and so on. To some degree, this has been effective, but if I have witnessed really a big element of challenge has been this sort of change in life, change in sort of the way in which a lot of the support became suddenly unavailable. The next question is, what is your medical opinion on the antiviral medication remdesivir, currently in stage 3 trial? I hopeful, like anyone, that this drug and a number of other drugs which are being tested will help us manage this disease as a final treatment or a final vaccine will be developed. We are learning that not every treatment or every drug is good for every person at every stage or every age. And one of the questions that we all have is, are any of these medications having an effect on Parkinson? We know many times that certain drugs used for many different other indications may worsen Parkinson, exacerbate certain symptoms, or have a negative effect in one way or another. So we don't know, as far as we know, none of the drugs which are being used and tested or being tested for the COVID-19 has any negative effect on Parkinson's disease or have any kind of interaction with the Parkinson medications that people are using. So we are hopeful that this medication will work. And certainly we are on the watch, but as far as we know, there has been no interaction, no concern specifically for Parkinson and the use of these drugs.
Okay. The next question is, should people with Parkinson's disease get antibody tests if they did not have COVID symptoms, or should they wait for more conclusive antibody tests before considering testing? Well, I think that testing is critical for us to be able to manage and effectively determine how to reopen society. We need to know who has had COVID and who has not had COVID. Now, there are many antibody tests that are on the market, but not all of them have gone through rigorous validation. I think that personally, getting antibody testing will be important to know who's at risk and who's not at, and whose risk has been lowered because of prior exposure. My recommendation would be for us to follow the guidelines of the CDC as well as your respective state board of health and the tests that they're recommending that their medical institutions enact for antibody testing. But I know that this testing is now publicly available, and I think that it's important that as many people as possible be tested with the right antibody tests that have been validated, so that we know from a population standpoint who has had this infection, so that we could plan our next steps in terms of reopening society, reopening our businesses and medical facilities in order to keep those who have not been infected safe.
And one word of caution is there's still not a full proof that having the antibodies will be protective.
That's true. Yes.
The antibodies are becoming available commercially, and many medical facilities are offering. So it is important at a personal level. However, should someone have positive antibodies, shouldn't just become careless and stop wearing a mask and gloves because we don't know for sure that this will be protective. And with this, I'll step on the next question, which is, what effect do you think reopening will have on the spread of the virus? Should people with Parkinson's disease be extra cautious when their areas upon up business again? It is difficult to predict. There is a lot of worries that we all have in the medical world that reopening the gates, allowing people to be without mask, or releasing the rules for social isolation of the distance, may reactivate the epidemic. So there is debate, and every day there are new information. There are guidelines, and somehow, unfortunately, those guidelines may not be the same from state to state, and there is debate and no consensus on what's the best way. One practical approach to this is that there is, in my mind, safety always comes first. And we mentioned before that there is no special risk of having Parkinson. Doesn't increases your risk of becoming infected. However, most people with Parkinson are age 60 or above, and this is a risk for the infection, both for contracting the infection and having a more severe form. So my advice is to play on the safe side, and of course follow the guidelines of the health organization, whether it's the CDC or state health and guidelines and recommendations, but always plays on the safe side, and never think until we really are over this that you can relax and be too safe.
Okay. The next question asks, should they keep doing telemedicine appointments? If so, for how long? Well, telemedicine is here, and it's going to be with us for the foreseeable future. It is a way and a mechanism for us to keep delivering care to our patients as they're isolated at home in solitude at times. And it's an important vehicle for us to be able to manage our patients' motor and non-motor complications related or unrelated to COVID at this time. So telemedicine is important. And I'd encourage all patients to um, ensure that they are following up with their healthcare providers, especially their Parkinson's neurologists, to determine if there's a appropriate telemedicine platform for which their care can be continued during this time and for the foreseeable future. Because you do not want to go months and months without seeing your physicians and expressing your symptoms and reviewing your medication regimen during this time. It is critical that we, as a healthcare community, be able to take care of our patients that are not hospitalized. It's important for the general health of the community, and in order to prevent and to try to limit exposure and hospitalization. So I personally believe that the telemedicine will be here for the foreseeable future, and it's going to be a critical part with how we deliver care now and in the coming months.
And I think we all need to embrace it. We're learning how to deal with that. It's not the same. And I think, but it is. I think it's better than a phone call. I think that the visual connections is important and allows us to really do a lot of the work. The last two questions deal with sort of, again, the post-fat. What is the first question is, how should people with Parkinson's disease be introduced back into visits with family and friends? Is a staged approach advisable, or is everything at once okay? And this ties up with some of the other discussions we had before. Once we are advised by the health officers of state or the CDC that it's safe to meet our grandchildren again, or embrace our family and friends, and finally have go back to life, we'll have to use our judgment. And again, safety first is always the mantra. It's important to be selective and cautious. I wouldn't just reopen the gates and have a big party the day after my state health official says, we're releasing the healthcare guidance about social isolation. And also, I think it's important to be gradual, not just into how many people will be seen, but maybe you may start seeing again your grandchildren, and at the same time, limit the hugs and kisses, and sort of maintain sort of a sense of vigilance about the fact that until we have a vaccine and until this disease is over, it can resurface, and be safe and careful is always important. There is one last question.
Yeah, and it ties into the previous question. Do you have any recommendations on precautions for people with Parkinson's disease who are post-COVID-19 and are returning to rehab, such as occupational therapy, physical therapy, speech therapy? Again, I think Dr. Di Rocco highlighted this in his previous answer. Overcoming the disease is one thing, but sort of opening the floodgates and relaxing all social distancing measure without a cure may put us at greater risk for reactivation, reemergence of this infection. And we still don't know what the risk is and of being reinfected if you've already had COVID. And we have to keep in mind that there are many asymptomatic people out there who harbor the infection and don't know it and are able to spread it. So returning to outpatient rehab will, like everything else, will have to be a process with maintenance of social distancing in place in order to engage in it in a manner that keeps you safe and keeps others participating safe as well. I think it also is important that having overcome any sort of infection, including COVID, the importance of exercising and exercise classes, and as well as support groups that are that are still meeting, whether it's virtually at this time, is important in managing at home during these times of solitude. We have to keep in mind that maintaining a strong baseline function will give you the best chance of fighting this thing if you were to get it. And that includes exercise, that includes maintaining good sleep, eating on time, maintaining good hydration. These are the things we know are good for immunity, and we need to continue as a community together to emphasize those things, whether we do it in an outpatient facility or at home through telemedicine.
And I think those are good as concluding words of this meeting. If there is a message, if there is a lesson we'll learn in New York, is that it's important to stay strong. And to stay strong means to do all your exercises at home, even if you cannot go out. Maintain your routine. Don't let the changes in life sort of take over your life. Stay on top of your medications or your health. Use your phone, your FaceTime to connect with your friends, with your family, with your children, grandchildren, your friends, with your social worker. A lot of support groups are active. And I know it's not the same. I know it's not the same as really being in a group and being with the family. But there is a lesson learned, is stay strong. Stay strong will help you, one, avoid the risk of the infection. And if, God forbid, you were to become infected, being strong and being in better health will make a difference. And remember, most people, even those who end up in the hospital, do well. Most people have a hard time for 1, 2, 3 weeks, but we'll go back to life. We'll go back to normal life. And people with Parkinson, as far as we have seen, do follow this pattern. People with Parkinson, even those who unfortunately develop the infection, may struggle, but vast majority of people come back to their life, and vast majority of people overcome this infection. So stay strong and remain in touch with the community, with your doctors, with your physical therapists, with your support system. And I want to give a special thank to the Parkinson Foundation, which has really become an important institution as we collectively face this crisis, no matter where we are in the country, and I can tell you in the world, the Parkinson Foundation's resources are being watched and used by people all over the world. I, like Dr. Ramdhani, also to offer a few final words.
Yeah, I'd like to thank you, Dr. Di Rocco, and the Parkinson's Foundation for being such a trailblazing national organization during this crisis. I think that the resources that the Parkinson's Foundation has made available to the community is invaluable in helping people prepare both mentally and physically to deal with this change in life that we're dealing with right now. to the larger community, I just want you to know that this is beatable. We will get past this, and the more you know, the more empowered you will be. And as Dr. Di Rocco eloquently said, stay engaged through FaceTime and Skype and all the other social media platforms out there with family and friends and social networks and support groups. It is important to not only take care of your physical well-being, but your mental health during this time. I wish you all safety and good health during this time, and to stay connected with your providers, with your family, and with the community. All the best.
My best to all, and thank you.